All right. So, yeah, thank you, Dr. Dimitriou, for inviting me, and it's an honor to present a case here. And I really look forward to join you guys in Greece again. I really had a good time, and I just can't wait. The pandemic just like stopped everything. So, yeah, I think everyone is affected, but I'm glad that it's kind of calm down a little bit, and we're looking forward to get our life back. So let me get to the point. And my specialty is scalp acupuncture, and I have been doing this for altogether 25 years. From my clinic, I see a lot of success when I combine the scalp acupuncture with physical therapy or occupational therapy, even speech therapy. So one of the cases that I've seen before was this gentleman from Arizona, and he traveled from Arizona to California. It takes about 5 hours.
Recording in progress.
Okay, he traveled about 5 hours to see me and receive scalp acupuncture. He has never walked since he had a stroke a month and a half ago. And this is the first day that he received scalp acupuncture, and he definitely see the dramatic change. So let me play this video. That will
Dr. James Liu, we do not hear the.
Yes.
We do not hear it.
You cannot hear it. Hold on. Let me see if I can share.
So I think it's because when you share with Zoom, you haven't shared the sound. So if you stop sharing and share again, you'll have a little icon at the bottom saying share sound when the window pops up.
Okay, hold on. Stop sharing. Okay, and then share again. Okay. Now,
when you shared the window that popped up, did you see at the bottom there is a share sound also, or did you click on that?
No, I didn't. I don't see it. I don't see sharing the sound.
So stop sharing again.
Okay.
And when you just press or share, you'll see that before selecting which screen and sharing, you'll see at the bottom left, I believe, there's a little writing saying share sound on that window. When you click share screen. No?
Okay.
Okay.
No.
All right. I think we won't be able to have the sound then, in that case.
Let me see. Okay. Let me see if I can. So switch to test microphone. Yeah. Huh. Interesting. Okay.
James, if it doesn't work, you can always describe the case, yeah?
Okay, sure. Okay, so right now, okay, you still cannot hear it? Can you guys hear it?
No, we can't.
Okay, let's see. So this gentleman came in, he has never walked like I described before, and he's trying to seek some solution for his disability. No one can help him walk. I mean, he has some PT and OT, but normally they help him with some range of motion. And this is so much he can move now. The leg is just like basically limited range of motion. And for the arm, as you saw earlier, he was not able to touch the shoulder. But now, after I gave him the scalp acupuncture, I tried to activate the shoulder muscle and ask him to reach up to increase his range of motion. And now, after that short activation, he is able to reach up overhead. And if you remember, he could not reach above his shoulder before we start the treatment. And now I want him to practice walking a little bit after I started acupuncture. So this is something that he has never done since he had a stroke a month and a half ago. So he could not hold himself. He just like so excited that finally he's on his feet again. And he said, finally I can walk. Finally I can walk. So this is the second day. He because of the financial reason, he could only stay for 3 to 4 days and has to go back to his home in Arizona. But at least during those 4 days, he came in like 2 hours every day, practice walking by himself and work on his arm. Of course, every time we start the scalp acupuncture, followed by the body acupuncture. And this is the day 3, he's able to walk by himself. He came in with a wheelchair. And he went home without needing a chair. Okay, so that's the a very quick case. On top of that, I do want to go in depth about scalp acupuncture, why we are using it, what kind of benefit can we get from that. So I also, in addition to working in a clinic, I also work in a hospital as well, from ICU to inpatient rehab to outpatient clinic. I see about 10 to 15 stroke cases every day. So most of the time we get significant improvement. Like this gentleman, I started seeing him in ICU. By about 3 weeks later, he was able to walk with just one person assist in the clinic. And remember, he was in ICU with NG tube, and also, you can see all those kind of equipments in the ICU. Also, another cases, this lady also was in ICU when she had a stroke, and I helped her walk from inpatient rehab. I saw her started in inpatient rehab where they stayed for 3 weeks, received PT, speech, and acupuncture. And by about 6 months later, she went home pretty much independently and able to enjoy her life and family by herself. Some cases that I don't get to see them in a hospital, but they found me through internet, through word of mouth. and same, I treated them also with the scalp acupuncture in conjunction with the therapy. Usually we use pretty aggressive approach, which means we want them to be on their feet the first day, whether they are in bed for a long time or they've been in chair for a long time. Of course, we want to make sure that their blood pressure is okay, so they don't have orthostatic hypotension, or they develop like too much dizziness. And most of the time, they are amazed how much the scalp acupuncture can make such a big difference. And they just like, we see them crying all the time because it's just like life changing. It is life changing for them. So in the inpatient rehab, one thing we did back to about 3 years ago was to get all the data. Like, we had so many patients receive acupuncture. However, we also had a group of patients that are kind of skeptical, and they're like, I don't know if the acupuncture can help me. So they refuse to receive acupuncture. So we collect 160 patients data from the Good Samaritan Hospital where I worked, in the inpatient rehab. So 80 patients received scalp acupuncture, and another 80 patients refused to receive scalp acupuncture, but they still have PTOT, the regular PTOT, and the speech therapy. So what we found was that both groups showed statistically significant improvement from the admission to discharge. They do improve in their functional level. However, the group with scalp acupuncture has more improvement compared to the one without scalp acupuncture. So this is the research that we work with local university, and this is the result that we got. It was done about 3 years ago. There are other similar research, systemic review that's available outside. This one is in 2015. And the conclusion of this research was that acupuncture in combination with the rehabilitation may have benefit for the treatment of acute and a subacute stroke sequelae in comparison with the rehabilitation alone. This is the article in Acupuncture in Medicine. Another one that really lists what are the benefits, why this scalp acupuncture can make such a difference for patients that suffer from stroke. This one, it was done in 2017, and in the International Journal of Molecular Science. And what we found was that it helped to promote the neurogenesis and the cell proliferation of the central nervous system. Number two, it improved the regulation of cerebral blood flow in the ischemic area after the stroke. Number three, it produced anti-apoptosis in the ischemic area. Apoptosis is like programmed cell death. Usually that's what happened after the stroke, after there's a blockage or hemorrhage in the brain. Number four, it helped the regulation of neurochemicals to help the connection of the synapse, and also to improve the synapses of the brain cell. And number five, it helped with improvement of impaired long-term potentiation and the memory after the stroke. So that's what we found, why acupuncture is able to help to improve the functional level after the stroke. So I guess that's the time that I have. But basically, I think there are a lot more evidence out there that help us understand why the scalp acupuncture is able to produce such a dramatic difference when we combine with therapy. Okay. any questions, I can help you guys.
James, we were a few minutes late, so you have 2-3 minutes more if you want to go. Yeah.
Oh, okay. Yeah. So I'll be happy to answer any questions later on, but this one, I'm gonna bring another research. So basically, it helped the acupuncture is able to help to improve the circulation in the brain after the stroke, and also it decreases the edema, and that's also showed in many other research as well. What it does is after the stroke, it's just like when we had a cut on the skin or we had an injury, the local area will have some swelling, and that's brain edema after the stroke. Brain edema can cause decrease the cognitive state and also cause the shift of the midline. If you, it easily could be seen in a CT scan. So with that, patient will feel like a drowsy, and the recovery won't start until the edema start to decrease. And after that, if we start acupuncture in time, then the edema can significantly decrease. We see that as evidence with the CT scan, because when we do this scalp acupuncture in the ICU, we can do CT scan on a daily basis. So they can kind of let us know, oh, this is the change after we start the acupuncture. Of course, we do body acupuncture as well, but the scalp acupuncture can really, it's really showing a lot more benefit than the body acupuncture. In addition to the juice scalp acupuncture, I also use international system. The international system is kind of like a combined work of all the schools of thoughts in terms of scalp acupuncture. So Dr. Zhu Mingqin, Dr. Jiao Sunfa, they're all joined in the meeting in the 1970s, to create this international style. And to me, I use international style more and more, and I found that it's very beneficial in many more cases. So I think it's just not been explored enough. But if we want to like study more, I'll be happy to share with everyone in Greece.
Thank you, Dr. James. We look forward to having you again. I have put it on the chat here for the ones that they are not familiar with Zoom. There is a chat box, and I have put the email of the company. It's info@hccm.gr. So if you would like to join on a seminar with Dr. James Liu in Greece, please do send your contact details so that we can send you all the relative information as soon as we have it. So we look forward on having Dr. James Liu again on 2023. Just to share my experience with him while he was here in Greece for a few days. It was really a pleasant seminar. It was full of knowledge of Dr. Zhu's scalp acupuncture, and it is a pleasure to hear that we could also have like a combined lecture of Zhu's scalp acupuncture and probably international scalp acupuncture. And just to finish and let you sleep, James.
Yeah. No problem. I'm all pumped right now.
Sure.
It's
about your case.
It's 12 a.m. right now, but I'm okay. It's Saturday, so
okay.
I don't have to go. I don't have to work tomorrow.
Sure.
Yeah.
So about the case study, do you use some special style of body acupuncture? Because later on we're going to have a friend from Brazil Dr. Katidio, that he was in Tianjin University and he studied the Sinao Kai Chiao method. So do you use that method for when you use body acupuncture, or do you use some other type, and what kind of body acupuncture you use?
Yeah, I use Sinao Kai Chao. Actually, I was in Tianjin, follow Dr. Shi for about 6 weeks. I had that externship after I graduated from acupuncture school, and it was a great experience too. They do see a lot of stroke patients, and they like to use many needles on the body, and also the Sinao Kai Chao. But I mean, to me, I use the motor point a little bit more. So the motor point with electrical stimulation a little bit more. With Sinao Kai Chao, I have limited result. I don't see a lot of result, but maybe there are better practitioners than I do, but I use it periodically.
Right. Okay, thank you for that. Yes, the motor points are another important part of stroke rehabilitation. Yes, great.
Right.
Great. Are there any questions from the colleagues around? If there are no more questions, then I'm just going to say that Dr. James Liu and also Dr. Jiao Shunfa and Dr. Juming Qing was all an inspiration for me to write the first book of scalp acupuncture here in Greece. I have finished it recently. I have also mentioned you in a page. Liu, I have written a page about you. Unfortunately, it's in Greek, but when you're back in Greece, I'm gonna give you a copy, and you can I can explain you.
Of course.
Yes.
Yeah.
So
look forward to see that. Yeah, looking forward to see you in Greece as well.
Thank you. Okay, for the English-speaking practitioners and attendants around the world, I just need to announce that the English-speaking part of the conference is going to continue from 11:30 to 1. So if you want to have a break, you're free, because we're gonna start with the Greek participants right now. So again, Dr. James Liu, it was really nice connecting with you again, and thank you for joining us. So
yeah, it's my pleasure.
Thank
you. All right. Thank you.
So I'm gonna switch in Greek now, and θα μου δώσετε μισό λεπτάκι. Θα κάνω share screen. Οπότε θα πάρω 5 λεπτά. Ξέρω ότι έχουμε αργήσει λιγάκι, αλλά είναι αναμενόμενο. Έχουμε κάποια διαλύματα και επίσης είναι και ένας από τους Έλληνες εμιλητές οι οποίοι δεν θα είναι διαθέσιμος σήμερα. Οπότε θα σας παρουσιάσω το νέο μου βιβλίο. Για όσους δεν το γνωρίζετε, έχω βγάλει ήδη 4 βιβλία μέσω της Ελληνικής Εταιρείας Κινέζικης Ιατρικής. Το ένα είναι για την μέθοδο εξισορρόπησης, ένα εισαγωγικό βιβλίο για τη βασική μέθοδο εξισορρόπησης. Το δεύτερο είναι για τη μέθοδο εξισορρόπησης σύμφωνα με τα 8 γκουά και το πώς κάνουμε την εξισορρόπηση με τα 8 γκουά. Έχω βγάλει ένα βιβλίο για τα βασικά κανάλια και τα σημεία και ένα βιβλίο για το σύστημα του βελονισμού του ΤΑΝ. Έτσι, το ξέρουμε σαν ΤΑΝ, κανονικά είναι DONG, για όσοι το γνωρίζουν. Οπότε στην ουσία είναι κάποια εξειδικευμένα βιβλία. Αυτό είναι το πρώτο βιβλίο το οποίο γράφεται για τον κρανοβελονισμό στην Ελλάδα. Θα σας δείξω λιγάκι κάποια από τα κεφάλαιά του. Αυτό εδώ είναι στην αρχή, αυτό είναι το ISBN του. Στον πρόλογο εδώ πέρα είναι που εξηγούσα ότι έχω γράψει για όλους τους καθηγητές με τους οποίους ήμουνα μαζί. Ο Jiao Sunfa, για όσους δεν το γνωρίζετε, είναι αυτός ο οποίος εγκατέστησε τον κρανοβελονισμό, και ο Zhu Mingqing είναι ένας πολύ σπουδαίος ιατρός του κρανοβελονισμού. Έχει βγάλει το δικό του σύστημα, έγινε πολύ γνωστός στην Αμερική, και ο Dr. James Lu που μίλησε πιο πριν ήταν ένας από τους βασικούς μαθητές του, που διδάσκει σε όλο τον κόσμο τον κρανοβελονισμό του Zhu Mingqing. Υπάρχει μια εισαγωγή που μιλάει για τις δράσεις του βελονισμού, για τα είδη του βελονισμού. Το δεύτερο κεφάλαιο μιλάει για την θεωρία του κρανιοβελονισμού, και επίσης αναφέρεται σε κάποια σύνδρομα του εγκεφάλου. Τα σύνδρομα του εγκεφάλου είναι κάτι σχετικά νέο στην ασιατική ιατρική, δεν υπάρχει στα κλασικά κείμενα της ασιατικής ιατρικής, διότι ο κρανοβελονισμός, από ό,τι γνωρίζετε, είναι κάτι το οποίο πρωτοανακαλύφθηκε περίπου το 1950, τη δεκαετία του 50, και εγκαθιδρύθηκε το 70, οπότε από τότε σιγά σιγά δημιουργήθηκαν περισσότερα σύνδρομα και πληροφορίες γι' αυτό. Δεν είναι κάτι το οποίο υπάρχει από την αρχαιότητα. Όσον αφορά τη θεωρία, μέσα σε αυτήν υπάρχει και η πληροφορία που έρχεται από την κλασική ιατρική. Και μετά περνάμε στο τρίτο κεφάλαιο που είναι κυρίως για τον κρανοβελονισμό. Περιγράφω οτιδήποτε υπάρχει τον κρανοβελονισμό. Στο κεφάλαιο 4 υπάρχει ο κρανοβελονισμός σύμφωνα με τη διεθνή τυποποίηση. Είναι αυτό που ο Dr. James Lu ανάφερε ως International Standardization. Αυτός είναι ένας κρανοβελονισμός, όπως είπε και αυτός, ο οποίος έχει πάρει στοιχεία από όλους τους κρανιοβελονισμούς, από τον κρανοβελονισμό του Jiao Sunfa, αλλά και από άλλους κρανοβελονισμούς που θα δούμε παρακάτω. Είναι κυρίως του Jiao Sunfa, βέβαια. Αυτός είναι ο διεθνής τυποποιημένος κρανοβελονισμός. Πολλά σχέδια που το κάνει αρκετά επεξηγηματικό και εύκολο στη χρήση, γιατί νομίζω οι περισσότεροι από εμάς, τουλάχιστον εμένα, δεν μου αρέσει να διαβάζω τόσο πολύ περίπλοκες πληροφορίες. Είναι πολύ καλό αυτές οι πληροφορίες να αποτυπώνονται όλες σε μια εικόνα, και αυτό έχουμε προσπαθήσει να κάνουμε στο βιβλίο αυτό. Οπότε εδώ πέρα βλέπουμε το 4 κεφάλαιο ήταν με τη διεθνή τυποποίηση. Αυτή εδώ είναι το 5ο κεφάλαιο που έχει να κάνει με το σύστημα κρανοβελονισμού του Jiao Sunfa. Οπότε διεθνή τυποποίηση, Jiao Sunfa. Το 6ο κεφάλαιο έχει να κάνει με τον κρανοβελονισμό του Dr. Zhu Mingqing. Οπότε εδώ πέρα έχουμε όλο το σύστημα από όλους τους κρανοβελονισμούς. Είναι το πρώτο βιβλίο που γνωρίζω εγώ τουλάχιστον, το οποίο να τα έχει βάλει όλα μαζί, όλα τα συστήματα, και ανά τον κόσμο δεν έχω δει κάποιο άλλο τέτοιο βιβλίο. Οπότε είναι πολύ καλό με αυτή την έννοια, διότι βάζει όλα τα συστήματα και κάποιος μπορεί να έχει access, δηλαδή με ένα βιβλίο να μπορεί να μάθει όλα μαζί. Και επίσης έχω συμπεριλάβει και το 7ο κεφάλαιο, που εδώ πέρα έχω κάποια άλλα είδη κρανοβελονισμού, τα οποία είναι όσον αφορά τον κινέζικο βελονισμό λιγότερο γνωστά, όπως του Tang Song-Yan ή του Fang Yupeng. Εδώ πέρα είναι σχετικά λιγότερες οι πληροφορίες, γιατί προσωπικά δεν μπορώ να πω ότι τα έμαθα σε αρκετό βάθος, οπότε αναφέρω τα πράγματα τα οποία γνωρίζω. Και παρότι ο κρανοβελονισμός κατά Γιαμαμότο δεν είναι κινέζικος κρανοβελονισμός, όπως αναφέρει και ο τίτλος του βιβλίου, τον έχω συμπεριλάβει, όπως βλέπετε και σε αυτά εδώ τα σχήματα, διότι είναι ένας βελονισμός ο οποίος έχει και αυτός πολλά να δώσει, και κάποιος ο οποίος θέλει να έχει ένα πλήρες εγχειρίδιο στα χέρια του, είναι καλό να υπάρχουν και αυτές τις πληροφορίες μέσα. Ούτε όσον αφορά τον γκρανοβελονισμό του Yamamoto, δεν μπορώ να πω ότι και σε αυτόν είμαι απόλυτα ειδικός. Έχω κάνει κάποια σεμινάρια, τον έχω εφαρμόσει. Είμαι περισσότερο ειδικός στον γκρανοβελονισμό τον κινέζικο και γι' αυτό έχω αφιερώσει και ειδικά κεφάλαια για αυτόν. Αυτό εδώ είναι σαν ένα συμπληρωματικό κεφάλαιο για αυτά τα αξιόλογα συστήματα. Και τέλος υπάρχει ένας κλινικός οδηγός, ο οποίος βασίζεται κυρίως πάνω στη διεθνή τυποποίηση. Οπότε εδώ πέρα μπορούμε να δούμε κάποιες παθήσεις και πώς αυτές αναλύονται και πώς μπορούμε να τις θεραπεύσουμε τον γκρανοβελονισμό. Αυτό είναι το βιβλίο. Ευχαριστώ για την προσοχή σας.